So, the last lecture on muscle is the myopathology. My is muscle, pathology means study of diseases. In this lecture, we'll be discussing some important but very common diseases that we encounter with muscle. First word to know is fibrosis. Fibrosis sounds like fiber. So, this kind of condition is found in muscle and other tissues incapable of regeneration. We know this word. In other lectures, we learned about regeneration. Um, so, if that is not possible, the muscle will heal with fibrosis. And collagen is used to repair an injury in skeletal muscles. And scar tissue of dense, irregular connective tissue forms that does not function normally. And this is how it looks like. So you can compare these two pictures, the left and the right one. On left side, the healthy tissue, soft, supple, flexible muscle, highly functional and decreased uh, joint load here. But on the right side, that muscle is replaced by fibrotic tissues, that whitish areas, the fibers you see there are hard, fibrous, inflexible, less functional, and that will increase the joint load. So this is fibrosis, where the muscle fiber will be replaced by the fibrous tissue. Myasthenia gravis. My means muscle, asthenia means weakness. So weakness of muscle, and it is an autoimmune disease. We know that autoimmune means when the immunity of the person is attacking the person himself or herself. Immunity should be protecting from the external world or from any invaders. But when it is attacking our own cells, this is a critical condition, autoimmune disease. In this case, it will destroy the acetylcholine receptors on the motor end plate. You know that, right? In the synapse, out of three components, the third one was motor end plate, where there are some receptors waiting for the acetylcholine to bind, and the gates will be opened for sodium. But if those receptors are destroyed, there will be no um, the synapse will become inactive. I mean, from the nerve terminal, the axon terminal, this um impulse will not be transmitted into the muscle. So the strength of the end plate potential declines and more difficult to stimulate action potential there. That will produce partial or full paralysis. Because now in myasthenia, just to simplify, this diagram shows where is the problem. The autoantibodies are attacking those receptors, and the muscle will not work. Like you see in this picture, the right side of our face is not working. Muscles are very much paralyzed. Next condition is Duchenne muscular dystrophy, DMD. It's a degenerative muscle disease occurring almost always in boys. Why boys? Because this is a disease on X chromosome. It's carried on X chromosome. And boys only have one X chromosome, no one to replace or don't want to compensate for that, unlike the girls. Girls have two X's. Now, in the X chromosome, there's a defective gene called dystrophin gene. If this gene is defective, this boy will have DMD. And this gene will encode a structural protein of cardiac and skeletal muscle fiber that anchors sarcolemma. You know that sarcolemma is the cell membrane that in the muscle, and if the protein is defective, these muscles will not work. In this picture, it shows that the progression of the disease, um, slowly the muscles are becoming weak, and at some point, the person is uh, has to move with a wheelchair. Now, without the functional dystrophin, the sarcolemma breaks down, the muscle fibers are destroyed. They may die and replaced with fatty tissues and fibrous connective tissues. Symptoms between age 2 and 6, they start to show and include weakness in the proximal limb muscle. This is why they are unable to move after certain progression. And under microscope, when you take a biopsy, we see those muscles like this. Just compare the left one with right. On left side, the normal muscles, healthy one, but on your right side, you see many of those are replaced by fatty tissues and fibrous tissues. By age 12, they are wheelchair bound, and death from cardiac and respiratory failure occurs about age 20. Muscle spasm, right? So, this is what happens. Many people they suffer from this pain because of muscle spasm, which is unable to relax due to dehydration, electrolyte imbalance, muscle injury, or muscle overload. It varies from tight muscle to full painful spasm. The botulism we talked earlier in another lecture, but just to go on with that, just to refresh our memories, it is the toxin from the Clostridium botulinum bacteria. And if we take contaminated food, especially from the canned food, without proper sterilization, muscle will be unable to contract and respiratory failure follows because of the toxin, which is going to not allow those acetylcholine to be released from the presynaptic uh, axon terminal. Clinically, this toxin, the Botox, are used for pain relief and to remove wrinkles. These are the symptoms you see here: drooping eyelids, facial weakness, trouble breathing, nausea, difficulty swallowing, dry mouth, vomiting, and paralysis. Now, look at this baby. Its muscles are having low tone due to nervous system disorder. Muscles are flattened and feel soft and loose rather than firm, and this condition is called hypotonia. The hypotonia is the low muscle tone, whereas hypertonia will be high muscle tone. Muscles feel hard and may shorten to cause painful joint contractures. Normal hypertonia during shivering can be observed. Now, those two muscles you see at the bottom of the slide, the right one is increased in number of myofibrils in diameter of the muscle fiber. This is hypertrophy. It is maybe due to resistance or strength training. We can build up our muscles, and this is what happens. They are hypertrophied. When the muscle fibers are decreased in diameter due to loss of myofibrils, that is atrophy. Reduced in the oxidative enzymes, strength and endurance declines, and it is due to disuse of muscle. Muscle knots are like this. You see, sometimes within the muscle, we can find those knots. Uh, Myofascial trigger points occur when muscle fibers or fascicles remain in painful contraction that will not relax. Palpating muscles used to identify trigger points and due to repetitive exercise or sudden muscle use. Treatment is to relax muscle fibers. Massage therapy, anti-inflammatory medications, and muscle relaxants are helpful. Regular stretching activities may be useful and a healthy diet. Strain is commonly called a pulled muscle pull. Excessive stretching and possible tearing of a muscle due to overuse or abuse. This can happen. The injured muscle becomes painfully inflamed. This is strain. Myalgia is the pain of muscle. Algia means pain. So muscle pain from any muscle disorder that is termed as myalgia. And myopathy is the disease of muscle. My is muscle, pathy is disease. So before we finish, I have this slide for you. Try to match the description with the disease on the right side. And that's all from my end. Thank you very much.